Hi, I'm little Susie.
And I am Dr. Whitecoat.
Well, I am 5 years old. And I was wondering,
Yes,
is that a hairpiece?
why don't we move on?
Why is that person lying over there?
That is an excellent question, little Susie.
Really?
Yes, you see, that man is dead.
What?
Oh ha 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 ha. I meant he would be dead if we had not just resuscitated him.
What does that mean?
It means that he went into cardiac arrest on his way to the hospital, and we performed CPR and gave him medications like epinephrine and atropine.
Shouldn't he have also been intubated?
All in good time, little Susie.
No. I really think he should be intubated.
Who is the doctor here? And who is the 5-year-old?
I may be 5, but even I know my ABCs.
Anyways, now that we have resuscitated him, we are going to begin hypothermic protocols.
What does that mean?
When a patient has had a period of insufficient blood flow, like after a cardiac arrest, tissues in their body like the brain are at risk for ischemic injury. The cellular membranes become unstable, and they don't have enough oxygen to complete their cell cycle, and when the tissue reperfuses, it is also at risk for injury from various inflammatory immune processes.
How does the hypothermic thingy help?
When we implement the hypothermic protocols, we want to institute them as early as possible. We want to cool the patient's core body temperature to 32 to 34 degrees Celsius rapidly, within 6 to 8 hours. This cooling process should last for 24 hours.
How do you know when the 24 hours are over?
The 24-hour period is from when you first initiate the cooling process. It is not from the time when you reach your target temperature.
That makes sense.
It does? Really?
I said I am 5, not stupid.
Right. Well, to achieve the goal temperature of 32 to 34 degrees Celsius, you can use methods like cooling blankets, ice packs, iced lavage, and cold saline infusions. We monitor their temperature with a bladder temperature probe or a rectal probe.
Bird sounds cold and uncomfortable.
It is, especially for the patients. But if they start to shiver, it could generate heat and impair the cooling process. So it is usually necessary to sedate and paralyze the patient when we start the procedure.
What happens when the patients reach the goal temperature?
When that occurs, the ice bags, if being used, can be removed, and only the cooling blankets will be needed to maintain their temperature.
What happens when you reach the 24 hours?
At 24 hours is when you start to rewarm the patient. You start by removing the cooling blankets and any ice that might still be in use. Then you let them warm up at a rate of 0.5 to 1 degree Celsius every hour. Especially during this time, you want to monitor them for hypotension. It can happen as vasodilation occurs.
What does all of that mean?
It means that by using hypothermic protocols on your patient, you will have a decreased risk of mortality and ischemic brain injuries, as well as increasing the chances of a more favorable outcome for the patient.
Sounds good. So anyways, has anyone ever told you that you look like that guy from KFC?
What?